why do we decide when we go to the doctor? It seems a bit ridiculous that those of us with no medical training whatsoever get to decide how physicians spend their time. As an aging and growing population, health is becoming more and more important to New Zealanders, and more of us are going to require healthcare more often. This increase has already been seen in the statistics. In the last 10 years, government expenditure in the health sector has increased dramatically. In the same period, surgical procedures, the number of surgical procedures, have increased by 40%. That's 50,000 extra surgeries a year. However, there are some serious inequalities and inefficiencies in how we use our health resources. Men, Maori and Pacifica, for example, are groups that show lower use of health services and so have higher mortality rates, lower life expectancies, and just general detrimental health effects as a result. 30% of the people who die in this country die of heart disease. That's preventable. It shows that there's a serious issue in how we approach health and treatment. What we need is a way to more effectively allocate the resources we already have in order to support the growing demand on our health sector. We're going to need to monitor the health of individual people and then allocate resources accordingly. And to do that, we're going to need lots and lots of information. Ideally, this information would come from continuous passive data collection about health indicators, lifestyle, and general mental health. From this, we could get an individual baseline. And if there is any long-term significant negative deviations from this baseline, it could be an indicator of a health issue, and this would be followed up by a medical professional. I must make it very clear that this is not a diagnosis tool. This is a way of facilitating a more collaborative patient-doctor relationship by giving both parties more information with which to make decisions. This could have the other effect, is that this could make us healthier. There are studies to show that as soon as we start collecting data about health, we subconsciously make healthier decisions because we don't like feeling bad about ourselves when we look at the numbers. Also, it could provide positive reinforcement, so when you make a positive lifestyle change and you see the evidence that it's working, you'll probably continue with that. We can expand this into remote patient monitoring. After inpatient surgery, a significant amount of your time is spent sitting and being monitored, even after your risk period has elapsed. We don't need to do that in a hospital. We can send you home and do it there. This would decrease the number of inpatient days and also just free up time and resources of the hospital to deal with other people. We could expand this into those patients who have chronic long-term illnesses like high blood pressure and diabetes. We can easily measure those data points at home. We don't need them to come in for rudimentary data collection just around information. This remote aspect becomes very important when we consider the high rural population we have in New Zealand. These people are impractically far away from healthcare, but they still get sick. And given the high instance of mental health issues in these isolated communities, we really need to find a way to monitor those symptoms and get them treatment as effectively and practically as possible. The thing is, we don't know we need to do that until we collect data about them. So, how do we collect this data? Well, we already do. How many of you have one of these, by the way? Hands up. Significant amount of you, right? There are a myriad of apps that use the sensors in our phones to collect a wealth of information about our physical well-being. We have heart rate. We can measure our heart rate. We have sleeping patterns. We can interface with wearable technology such as the Fitbit, the Apple Watch, to get more information about our activities and how much exercise we're doing and our weight, all of that sort of thing. It's already being done. This process of data collection and processing and just simple interface with what we're doing is so easy that it can be accidentally done by a cat. And I had a picture of a cat and a section of data where it had weighed itself accidentally and someone's phone had recorded it. And it was like, this guest weighs 10 and 0.6 pounds. Collecting data about mental health is going to require slightly more analysis, but it would essentially come from how we interact with our technology, so how we use our computers and our smartphones. So that would be typing speed, cursor movement, click speed, your reaction times in games. All of that sort of thing can be collated and used to form a picture about how your brain is working. We do this already. The brain training site Luminosity, well, they don't actually train your brain, have developed games that do test certain cognitive things, such as your spatial awareness, your visual spatial memory, so how fast you remember that the thing you just saw was over there, and just basically your cognitive flexibility and how you deal with new situations. They can test this. These games have also already been used in a medical environment. They've been used to help diagnose cirrhosis of the liver. That will make sense in a second. Cirrhosis of the liver causes a long-term, small cognitive degenerate effect. Well, it has that effect. So this isn't normally picked up, and this isn't normally used in diagnosis. But by tracking patients' performance in Luminosity games over a long period of time, the researchers picked up on this degeneration, and could put them forward to further tests. So once we've collected all this data, what would we have? We would have a framework in which we could collect the data. We would then analyze the data either client-side on your phones or your computers or in a different server, and then upload that data to a central data bank where it would be available to everyone who would normally be able to access your medical records. Because that's exactly what this is. This is a medical record. This is information about your health. So let me walk you through a hypothetical example. I am a 45-year-old man that lives next to the middle of nowhere on the West Coast. I am 1 hour away from a GP that's there 2 days a week. I am 3 hours away from the nearest hospital. I live with my 18-year-old daughter. I've been identified as having high risk of high blood pressure, and there's been heart disease in my family. I was issued a blood pressure cuff by my physician that interfaces directly to my phone. So I measure your blood pressure. You measure your blood pressure every 2 days. It is automatically uploaded into your phone, which is then automatically sent to the South Island data bank. My GP then accesses that data intermittently and checks how I'm doing. They're also automatically informed if my blood pressure gets above a certain point, so they can come up with a treatment plan if need be. My daughter has bipolar. Her health data is sent to the same data bank mine is, but it's accessed from a mental health institute in Christchurch, where they can monitor how long her manic and depressive episodes are, and so change therapy plans and medication doses as a result. That's something we'd never be able to do if they didn't have that information. She would be stuck with the treatment plan they gave her 3 months ago when we went to Christchurch. The great thing about this is that we don't need a new technology to do this. We don't need to wait 5 or 10 years for the researchers to come up with what we need. We already have the elements all there. We have the data collection. We have the ability to analyze it. We have the people who need the information. We just need to connect it all. Thank you.
Thanks, Kira. Your idea depends on a much better nationwide connectivity and broadband than we currently have, right?
Not necessarily. It can be transmitted over the cell phone network. If you have cell phone coverage, it could be done.
What you're really talking about then is a kind of a Fitbit connected to some national health grid.
Yeah, the Fitbit being this.
Yeah.
And it wouldn't necessarily, you'd either get raw data from this or you could get analyzed data from your phones as well, just so that there'd be less pressure. We don't need massive server farms to do this. We can do it all individually and then send the data to where it needs to be.
Any views on the probability of middle-class capture, the well but anxious signing up,
Could you
as
explain
opposed
that
to the
concept a bit more?
vulnerable? Well, you know, people with flash cell phones who are constantly monitoring themselves
Yeah.
will want to do it. The people who really need monitoring will not do it.
I would say it would be more of an opt-out service than an opt-in service. So we share our medical records all the time between doctors and well, doctors share our medical records all the time. But we need to, they don't inform us when we do that, and we don't tell them, yes, you are allowed. We have to say, no, please don't do that. And I think that would be more the case with this, is that if you have a capable device, and even if you don't have a capable device and you are part of that high-risk group, we could give you a far simplified version of it, so you have a small device that could collect the same information, but wouldn't be as expensive as this.
And so the insurance implications for a kind of constant assessment of an individual's health?
Well, Apple is already collaborating with insurance companies in the US because they have a health app on here that already collects all that data. They don't give it to the public health sector, but they do, if you decide that that's something you want to do, they do give it to your insurance company to have more data about you.
I don't want them to give it to my insurance company, thank you.
No, I mean, like, that's what they do already. But in the US, that's what they do. If you want them to do that.
My question was more around privacy.
It's more around privacy. Then it's, as I said, it's treated exactly like a medical record. So it would be under the patient-doctor confidentiality, under all of that. So it would be entirely up to you who got what, who got your data.
I appreciate your time. Thank you.
Thank you.